All right. Good afternoon, everyone. I am Chris Sorchik. I'm the Executive Director here at Capital Area Healthy Start Coalition. I want to thank you all for joining us today for our Lunch and Learn series. We are going to ask, because we are recording this, that if you are not speaking, to please keep yourself on mute. And a little bit about why we are here today. Our coalition's community needs assessment identified access to care as one of the key priority areas for our 5-year service delivery plan. Through the work of the Access to Care work group team members and our Fetal and Infant Mortality Review Project, we have identified health insurance or lack of health insurance as a barrier to accessing medical care, including prenatal care. In our local area, families struggle with knowing where to go to get affordable health insurance, or if families are insured, they may have high copays and out-of-pocket expenses, which create another barrier to receiving the care they need. The high copays also affect families' ability to pay for medications, lab work, and other medical tests. In today's presentation, we are going to hear about Big Bend AHEC's Health Insurance Navigator program and the Affordable Care Act. If you have any questions during the presentation, you can either put those in the chat or you can raise your hand and we'll call on you. So please welcome me in joining our presenter, Allison Wyman, the Executive Director of Big Bend Area Health Education Center and the Big Bend Rural Health Network. Ms. Wyman received a Bachelor of Science in Biochemistry and Agronomy from Purdue University. Shortly after graduation, she moved to Tallahassee, Florida, and was employed as an environmental consultant for 17 years. In 2010, Allison returned to school and received a Bachelor of Science in Nursing from Florida A&M University, and later a Master's in Public Health from Florida State University. She worked for the Florida Department of Health in Leon County as a senior community public nurse in school nursing. After leaving the Department of Health, Allison served as the senior health policy analyst for Florida Tax Watch with expertise in obesity prevention, food deserts, and nursing workforce issues. Allison was appointed the Executive Director of Big Bend AHEC and the Big Bend Rural Health Network in 2017. The mission of these organizations is to provide education and services to underserved communities and build partnerships to facilitate better health care for all. Allison serves on the Board of Directors for the National Alliance on Mental Illness and is active with the Florida Nursing Association. While originally from Chicago, Allison has lived in Tallahassee since 1996. Allison and her husband have 3 adult children. So please welcome me and joining Miss Allison with us today. I'm very excited to hear more about your program, Allison.
Okay, great. Thank you so much for that introduction. And I'm super excited to be here to talk to you about, granted, a pretty boring topic. Health insurance can be, but it's just so important. And it's such a huge social determinant of health. And so I'm hoping to leave you with some information that you can share with your clients about the Affordable Care Act and how it can help help insure your families that you work with. Okay, so we all know this, but I always like to start any presentation with, why is this important, right? Why do we need to know? So there's really three big reasons why we need to all be familiar with health insurance to help serve our clients better. And first, that's from a clinical perspective. As I just mentioned, not having health insurance is a huge social determinant of health. So these clients are going to have other issues as well, because we know that uninsured population, they don't see the doctor when they should because it's so expensive, or they're using the emergency room and there's that disconnect in care that happens so very often. And then also from a financial perspective, if you happen to be in healthcare and a pay per service environment, the more insured patients we have, the less uncompensated care. So just having more payers in our system who can support. And then from the caring perspective, and I got to tell you, this is one of my favorite parts of my job here, is when I can connect someone to health insurance who hasn't had health insurance, and suddenly they can take their family to the doctor. They can take care of their children when they're feeling, take them to the doctor and not worry about the cost of, okay, what's that going to be? Am I gonna be able to afford the medication or my car payment or taking my child to the doctor? So I see firsthand how life-changing that can be. And boy, it feels really good. It feels really good. Okay. Okay, so a lot of this goes back. We all hear talk about health literacy, and a part of health literacy is health insurance literacy. And that's defined by many things, but it's really a person's ability to seek, obtain, and understand and use their health insurance appropriately. So a lot of what I do every day is to educate people about health insurance literacy, and just provide some background on what terms mean and all of these. It's complicated, right? Health insurance is very complicated, so it's not surprising that there's low health insurance literacy. So this was a large study that was done, and this is the statistics that really stood out to me, and I think you probably see this in what you do. 48% of those surveys had low confidence in using their health insurance to access health care. That's a really big number, over almost 50%. And really, most had inadequate knowledge of what their health insurance is actually costing them out of pocket. Like, what are they paying for? What is the insurance company paying for? And not surprisingly, those with lower health insurance literacy are this group of people that are often marginalized, unemployed, uninsured, Medicaid, Medicare, lower education. Young adults are likely to have low health insurance literacy just because they haven't had to do it before, right? We work with a lot of clients who are aging off their parents' policy, and now suddenly they're 26, they need health insurance, and they have no idea. So I really like working with that group too. Those young, I actually helped my son get insurance on the Affordable Care Act. So that's exciting when he aged out at 26. And then, people with any kind of English proficiency issues, or, English as second language, also are more likely to have lower health insurance literacy. So there's a couple common healthcare programs. Many of you have heard of these, I'm sure, so I'll go over this briefly. Medicare, which is for people age 65 and older, and some individuals with special disabilities. The Medicaid population for low income with certain disabilities. Nearly 1 in 4 Americans are in the Medicaid program. Children's health insurance that provides coverage for kids in low-income families. Employer-based insurance is nearly half of all Americans receive some type of health insurance through their jobs. Sometimes that health insurance can be prohibitively expensive. So that's actually another place where the Affordable Care Act in the marketplace can come in, and we'll talk about that in a little bit. So there's employer-based insurance, and then there's what we do at Big Bend AHEC and across the state, and as part of CMS, is the Affordable Care Act marketplace. And this is healthcare.gov. It was created, it was called Obamacare at one time, but it's the Affordable Care Act. And that's what we're going to be concentrating on today. And then there's other options too, veterans insurance, tribal members, COBRA, etc. And if at any time you have questions, just please just interrupt me. It's It's no problem. Okay, so as we see here, this is what our current state here looks like right here in Florida. So about 12.7% of Floridians are uninsured. And you can see Leon has a pretty high state rate of insured, as does Wakulla. Those are both above or below, I guess, the state average. So more people are insured. But that doesn't mean that there's not pockets of heavily uninsured people within our counties. So let's look at some terms and definitions. This is kind of the boring part, but the very necessary part if we're ever going to understand what health insurance means. So the premium is the amount of money paid each month for healthcare coverage. So with employer-based care, generally that's split. So for example, our family pays about $300 a month for insurance, and the company covers about $700 of that. So that's the premium, is the amount that the individual pays for healthcare each month. That's a standard cost month to month. Cost sharing is an umbrella term for what a consumer's costs will be for the healthcare they received. And cost sharing comes in deductibles, co-pays, prescriptions, and other kinds of services. So a co-payment, that is when you go to your doctor, your co-payment is, usually it says it on the back of your card, your co-payment is what you pay for each time you go to the doctor. So if your doctor visit costs $100 and your copay is $20, you're paying $20 of that, and the insurance company is covering the remainder $80 of that. So deductible is the first part of what you pay for your health care before the insurance starts to kick in. So say, for example, you have a $1,000 deductible, and each time you go to the doctor, it's $100. So you have to go to the doctor 10 times and pay that $1,000 before your insurance pays anything. So, and deductibles, high deductibles generally mean lower premium costs. So it's a balancing act, right, of what the family can afford. And then your co-insurance, this is where it gets really complicated. So if once you reach your deductible and your insurance kicks in, there's still a co-insurance cost with some plans. So for instance, you've met that $1,000 deductible and your doctor visit is still $100. Now you're paying $30 and the insurance is paying $70 up to a certain amount. And after that certain amount is reached, then the insurance covers everything. So it's so confusing, right? I mean, and imagine having low health literacy, low health insurance literacy, English as your second language, and trying to wrap your arms around all this. So like I said, we do tons and tons of education. So your out-of-pocket maximum, that's just the absolute yearly as much as you're going to spend. So most insurance companies have a cap. So even if you're in a horrible accident, you've met all your deductibles, and all your visits, you're not going to have to pay any more for your health insurance. That's the maximum out of pocket. Okay, so let's talk about the ACA and the Federal Insurance Exchange, the Federal Marketplace Exchange. So the ACA, the Affordable Care Act, Obamacare, really absolutely changed the landscape of health insurance in the US. It was a tremendous piece of legislation. It opened up so many doors. And I'm really proud of Obama for getting this through and just pushing this forward, and everybody along the way that helped us. So before this was enacted, pre-existing conditions were, an insurance company could say, no, I'm not covering that. I'm not covering that. And so my own niece has a very a chronic condition that requires a lot of care, right? Very expensive chronic condition. And she was stuck in a job because she had to stay at this job, because if she moved jobs in insurance companies, pre-existing conditions weren't covered. So, I mean, you just had very little options. Insurance could say no. That all changed with Obamacare. That was absolutely huge. Free preventive care is a big thing too. That changed. And then some other things. But one of the biggest things is the health insurance marketplace, which we're going to talk about in a minute. Oh, and another thing that Obamacare did is young adults coverage. You had to cover children up to the age of 26 on your policy, which was really great for my kids and everybody, you know, because they could stay on our policy. So the ACA marketplace plans, they all have essential benefits that have to be covered, and these are what's included: mental health, substance abuse, prescription drugs, rehab, lab service, preventative and wellness service. Those are usually, well, almost always free, with, you know, because the Obamacare really wanted to encourage preventive and wellness service. So those generally have no deductible. They don't go against your deductible, and there's no copay for those visits. So in order to be eligible for marketplace health insurance on the Federal Health Insurance Exchange via the ACA, you have to be a U.S. citizen or here legally. And we do help people who are here legally. Oftentimes we have interpreters available to try to help understand and get through the application process. And you cannot be incarcerated is the other thing. Now, when you are released, you have a special window to sign up. In there, it's a little bit more extended. And a lot of outreach we do is to pre-release seminars and stuff to just try to get people to understand that, you know, once you are released, you can qualify as soon as you get a job, basically, which is sometimes easier said than done. When can you enroll in this coverage? So right now it's open enrollment. It started November 1st and it runs through January 15th, 2023. So that deadline is quickly approaching. So, you know, if you'd like me to come speak to anybody within your organization, or you want some promotional material, please let me know. The Affordable Care Act also has special enrollment periods, and those are for life changes. So if you've had a baby or moved or lost employee-based coverage, you know, say your hours are cut and you no longer qualify, all of those special reasons qualify you for a special enrollment period. If you happen to be part of a federally recognized Indian tribe or Alaskan Native, that open enrollment it's once a month. You can enroll, and year-round if you're eligible for Medicaid or CHIP. And then also year-round, and this is a new provision which we are very excited about, year-round low income, so from 100 to 150% of federal poverty level, can apply anytime for insurance. Okay, and you all are so familiar with this, the federal poverty guidelines. So this is basically what eligibility is based on, is this federal poverty guideline. So the closer you are to this area, 100, you know, 138 or so, the cheaper your insurance. Matter of fact, it's almost free. And we're going to look at some examples in a minute. The closer you are to this area, the less expensive your insurance is going to be, because the government picks up the rest of it. And then as you get over to the 400%, then you can still get some discounts, but of course not as many. Okay, so what I want to emphasize here, and there's a lot of misconceptions, and I see this daily and I work against it, that ACA insurance is not affordable. That's simply not true. And Florida Blue conducted a survey, and it was a fairly large survey of uninsured Floridians. And the main reason for not enrolling or not even trying to enroll is that people perceive the insurance is just too expensive. And most people thought their insurance was going to be between $500 or $50 and $500 a month. And that's simply not true. There's just a huge misconception about that. Even in some of our FQHCs that we work with, you know, they say, oh no, you know, it's unaffordable. There's not doctors here. You know, it's just, they can't afford. None of that is true. And that's why a navigator, what we do is so important, is because we educate people and we help them shop for the plan that is best for them. So basically, 4 out of 5 people can find plans for less than $10 a month on the Federal Health Exchange. And as I mentioned, most plans cover preventive care, including a yearly doctor's visit. So yes, tell people that they can't afford it, please. And if they don't believe me or believe you, send them to us. So what we do here at Big Bend AHEC is we help people navigate the system. And from what you've just seen, the system is very complicated. There's all of these terms. Anybody who's ever signed up for insurance probably knows this well. It's just a really difficult process, especially, like I said, with low health literacy or health insurance literacy. So that's what we do. We help navigate through the process. So right now in Florida, these are the commercial health insurance companies that offer plans. There's not as many here in Leon and McCulloch counties and up in the Big Bend, but there's still, I think, 6 health insurance companies that offer plans. And then of the plans here when you do a search for them, I think there's 112 different plans to choose from in Leon County among those 6 insurance. So lots of choice. So I mentioned, depending on what your income is, how this works is the government gives you what's called premium tax credits. So the government pays a portion of your plan each month directly to the insurance company. And then you pay the remainder. So you may still have something to pay. You might not have anything to pay. It just depends on where you are in that poverty line between 100 and 400%. Okay, so just like to make it more confusing, there's different kind of plans that you can pick. And so if you pick a lower premium, so that's, remember, a premium is what you're paying every month, you're going to have a higher out-of-pocket cost. But if you have a higher premium monthly, your lower out-of-pocket costs are going to be, you know, this is going to have the lowest, but you're paying for it monthly. So most people that we work with go with the silver plan, unless they're not planning to use health insurance, like they're a young, healthy 26-year-old, then they go with the less expensive plans. So also with some plans, those are the silver plans, they have decreased cost sharing. So they're paying less for their deductibles and less total out-of-pocket costs. Okay, so let's look at who qualifies. And hopefully you'll find maybe, so I didn't put families in here because it just gets confusing when I do examples with families, because there's a lot more at play, but this will give you a baseline. So we worked with a female, we'll call her SJ. She lived in Southern Leon County. She recently got away from an abusive partner. You know, it's funny, you sit down and help people and they tell you their whole stories. I'm sure you've seen that too. So anyway, so she was left her abusive partner, and she helps take care of her mom. She has no children right now, and she's living with her mom until she could find a place. And her estimated income was almost $14,000. And just to give you an idea, that's part-time at $15 an hour. So that's a little bit less than 20 hours a week, making $15 an hour. So we met her through one of our screening events, and we found out that she did have some health problems. She had some very high blood pressure, and her A1C was in the diabetic range. So we worked with her to get her insured. So this is from CMS. This is what we, This is what we use to sign people up. And to give you an example, we were able to find her a CHP plan. So I'm sure many of us have CHP. I know we've all heard of it. That cost her nothing. $0 a month, zero deductible. Okay. When she goes to if she goes to the emergency room, which of course we are discouraging, because now she does have, she has regular care. She doesn't have to go to the emergency room, but if she does go to the emergency room, she's going to be paying 25% of that cost, which is very expensive. Those visits are very expensive, but she could go see her primary doctor for just $5 copay and a specialist for $10. And her maximum out-of-pocket cost, so the total of what she would be on the hook for the year, would be $1,400. But hopefully, now that she has a primary care and a specialist she can see, she won't go to the emergency room, which is probably where most of that cost would come from. Okay. So another example, so 49-year-old female, lives in Wakulla, and she really has a significant medical history as well. She's a known type 2 diabetic, known to have lupus, and recently been diagnosed with severe anxiety disorder. So she makes about $21,000 a year working as a home health aide for a small company. She works part-time, and of course the company doesn't offer insurance because they're a small company. So let's look at her. Okay, so this is when, remember I talked about the bronze, silver, gold, platinum. So for her, she originally wanted a $0 premium because, who wants to pay? And with the bronze plan, we found her one, but look at her deductible is $2,400 a month, and the maximum out of pocket is really high too. So we continue to look for plans for her because remember, we know that she's going to be going to the doctor a lot, right? We know she's a type 2 diabetic. She's got anxiety and lupus. So she's going to be there a lot. And the plan isn't going to cover anything until she meets that deductible. So that's automatically $2,500 or $2,400 she's going to have to pay. So we kept looking, and we found a much better plan, a Capital Health Plan HMO. And for this, her premium was going to be about $250 a month, and her deductible was much, much, much less for that. So that was one plan that she could look at. And the other thing that we do for Navigators, and this can be so important to some people, is we can make sure that her current medical provider is accepted by this insurance. So this is a Capital Health Plan HMO. And so, it's only Capital Health Plan physicians in the plan that she'll be able to see. And she might be okay with changing physicians, I don't know. And she might have particular prescription drugs she needs. So we can check all of this too for the client, just to make sure. So that was one plan we considered. And then here's just another one. This was a little bit higher deductible, but the maximum out of pocket was less. So, it just really, that's where we really get into the details with the consumer. And, we never pick for them, of course, but we just take them through the process. Do you expect to, what are you expecting this year? Are you expecting any major surgeries? We just provide that high level one-on-one education. Okay, so let's look at just one more example. And do you guys have any questions? Okay. So let's look at one more example. So we have a male non-smoker, lived in Monticello, and he's currently a part-time student at a university here in Tallahassee. And he also works part-time. So his estimated income is about $6,000. He doesn't really use healthcare very often, but he is a nursing student and has encountered some patients during his last rotation. And he's scared about long COVID. So that inspired him to give us a call. Unfortunately, this individual does not qualify because he doesn't qualify for any insurance. He makes too little for the Affordable Care Act, Obamacare, and he doesn't qualify for any type of Medicaid because we did not expand here in Florida. So this individual's premium was going to be $302 a month with a whopping deductible. So remember, he has to pay all of this before the insurance kicks in. So, I mean, that's already what that surpassed his income for the year. So I share all this just to say that, there's many people that we can't help. And in that case, not many, but, there's people that we just can't help because they don't have the income requirements, which right now an individual has to make at least $13,600, right around there. And then it goes up by family. But, if you make below that, and you're not, a kid or, someone who is pregnant, we can't refer you to any program. So with those clients, we just make sure that they have the resources for the federally qualified healthcare centers and other sliding scale entities. Okay, so I'm just going to touch upon Florida Kid Care very quickly. You guys are probably more the experts on this, but yeah, Florida Kid Care, we can also help people with this. This is not we're a lot more knowledgeable with the Affordable Care Act and the Health Insurance Exchange, but we can also provide some support for Florida Kid Care. As you know, there's different types of Florida Kid Care. And it just depends, and it only offers coverage up to age 18. And again, the income requirements for the various programs. So, and it's interesting, some families, they do qualify to put their kids on kid care, but they actually choose to enroll them into the family plan with like CHP, just because they would prefer to have everybody have the same provider. So that's just one of the but we do help if we have a family situation and the kids qualify for one of these programs, we'll enroll the parent in like CHP, and then we'll find a different plan perhaps for the child. So we do consider the whole family, and we provide support for the whole family. So these are just an example of some of the, depending on where your income level is, how much the family would be paying for the various kid cares. Okay. Okay, so the next big subject we're going to talk about is the Medicaid Unwind. And this is going to have a or has the potential to have a really, really big impact on some of the clients you serve. So the notice came out yesterday that the Medicaid Unwind is going to begin very soon. And let me just back up and explain what this means. So when COVID hit since March of 2020, the federal government waived certain Medicaid and CHIP requirements for signing up. And they eased the rules about losing their health coverage. And basically, since the pandemic began, they haven't had anybody do any kind of reevaluation or so they haven't been reevaluated if they qualified. They haven't re-enrolled anybody. So if you had coverage beginning, in March of 2020 up to very recently, everything was relaxed. So in Florida, at the start of the pandemic, we had about 3.76 million people enrolled in Medicaid. And by just a couple months ago in November, the rolls were up to 5.58 million people were enrolled. So the difference of these people is probably going to be a portion of the people who are losing health insurance because they're being reevaluated and requalified for Medicaid. So the letter came out yesterday. Florida may start eligibility reviews beginning February 1st. So in 18 days or so. And they will start terminating people who are no longer qualified starting April 1st, 2023. And then by March 2024, everybody that no longer qualifies because of these restrictions, the easing of the restrictions, will be booted off of Medicaid. So that's potentially a lot of clients that will be impacted. So who's most at risk for losing coverage? Parents or caregivers whose income is now above the eligibility limits, right? So many parents, especially of school-age children, when all the schools closed, they lost their jobs, right? And qualified for Medicaid, but they're now back to work and their income is such that they would no longer qualify. And maybe their job provides coverage, insurance, health insurance benefits, maybe it doesn't. So parents and caregivers are going to be a big class. And then anybody who aged out of the program is also going to be ineligible now. Okay, so phase one of the unwind, and I've been doing this, I know many of you have too, is just telling people, hey, watch for your renewal, watch for that mail, make sure your address is up to date, please, and just watch for that notification from DCF. And now we're entering this phase two, which is really help people figuring out what's going to happen if they are losing their coverage. And that's where we can step in, and they may be losing their Medicaid coverage or their CHIP coverage, but if they're, low income family, still they will qualify for the federal health insurance exchange. Okay, so that brings me to the end of my presentation, but I just want to tell you how to enroll. You can call us to schedule an appointment with one of our certified navigators. All of our navigators have gone through training with CMS. Every year they do it. We have continuing education. So yeah, we deal with a lot of really complex situations. And if we don't know the answer, we have like a special line to CMS that we can call and get some answers. Because some of it can get very complex very quickly when you start talking about some of the family situations. And you can also go to healthcare.gov, and here's their number as well.
we will let you get back to your day. Thank you so much for joining us. We'll be sending, like I said, we'll send out the recording to this presentation. We can also share the flyers that we've created to provide the information to our clients as well. Feel free to utilize those with your clients. Our next Lunch and Learn will be on February 3rd, and we'll be sending out a flyer with information on how to register soon. Thank you all for joining us and have a wonderful weekend.
Thank you. Bye.
Thank you. Bye.